Good morning, everybody. Good morning, everyone. Pleasingly, there were more than 45,000 tests yesterday, and whilst it's slightly down, we know on weekends it tends to dip. So we're encouraged that so many people came to get tested on a weekend, and we encourage similar numbers today. Those high testing rates are so important in convincing us that we're not missing any chains of community transmission. To 8 p.m. last night, there were 16 cases of local transmission or community transmission. In 13 of those cases, the people were completely in isolation. One was in partial isolation, and only 2 were infectious in the community. So we are seeing numbers go the right way, but I do say cautiously that that could still bounce around. And we've seen in the last few days how easy it is for people to unintentionally do the wrong thing or intentionally do the wrong thing, and that can result in more cases, which is something we don't want to see. Dr. Chant will, of course, provide her update. But what we are seeing is that the transmission now occurring in households or within households. So we say to everybody, stay at home means stay at home. Only leave the house for exercise, only leave the house when you absolutely have to, and please don't go visiting each other because that's how the virus spreads. If people do the right thing, we have a greater chance of getting out of this in a timely manner. And whilst the numbers overnight are very encouraging compared to the previous day, we know that they still have a potential to bounce around, and we still know that the next few days are absolutely critical. The New South Wales government will be looking at, obviously, the health advice, but also that advice will depend on what the cases and the days of transmission or exposure in the community look like in the coming days. So whilst the results overnight are very pleasing, there's no doubt the impact of the lockdown has been evidenced. However, to keep that trend going, we need to make sure people don't give in and don't break those rules we've put in place. They're there for a reason, and yes, it's great sunny outdoors. We'd much prefer you to go outdoors in a COVID-safe way than go to those riskier indoor settings. But just be responsible and make sure that you don't leave the house unless you absolutely have to, especially when you're visiting indoor settings. And also make sure that when you are exercising, you're keeping a good social distance in a safe way from everybody else. So I'll ask Dr. Chant to give her update. Then Deputy Commissioner Warboys will give an update. Compliance is really important the next few days. It really stresses me out when we hear examples of businesses not doing the right thing, of individuals not wearing masks when they need to, because when people don't do the right thing, even if it's just a handful, it impacts all of us, and we don't want to see that jeopardise the good work we've been doing to date. So Deputy Commissioner Warboys will talk about those compliance issues, and now I'll ask Dr. Kerry Chant to give her update.
Thank you, Premier. So New South Wales recorded 16 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. 14 of those were linked to previously confirmed cases, and 5 of these linked as being household contacts. No new cases were acquired overseas in the 24 hours to 8 p.m. last night. As the Premier said, it's pleasing to see those high rates of testing, 45,079 tests, but we need to see it sustained, those levels sustained for the coming days. In terms of the new cases, 13 were in isolation throughout their infectious period, and this is what we're really going to have an eye to. If we do see cases occurring but people are in isolation, then they pose no risk of generating further cases in the community. 1 case was in isolation for part of their infectious period, and 2 cases were infectious in the community. For those that are close contacts who have been told you are a contact of a case, isolation means removing yourself from all others unless you are all co-exposed and are, because you're an adult caring for a child, isolating together as a group. Isolation means not leaving your house unless you need urgent medical care. And even then, you should be ringing ahead and taking the precautions outlined. So there is a distinction between isolation and the stay-at-home directions. The stay-at-home directions, again, we're asking you to minimise your exposures. You are permitted to get essential goods and services, but for the remainder of the time, stay as very much at home. You are permitted to exercise. And can I just again stress the fact that outdoors is the less risky. So rather than being tempted to have some people over or neighbours over or friends over into the house, enjoy the outdoors, walk around the block. I understand parents with young children and it's pleasing to see them riding bikes and everything outdoors, but keep away from others. We don't want any crossover between households. That we have 3 new cases, again associated with Great Ocean Foods, and again we've seen this as a very significant spreading event. So again, anyone who's still in that close contact and associated with that, please continue to follow the health advice. Whilst we do see cases most likely arise in the first 7 days, cases when you've been exposed at a certain point can even arise up to those 14 days afterwards. So still, please continue to get tested, and we do recommend everyone on their exit from isolation does get a test at that day 13, 12, 13 or 14 mark to give us that absolute assurance. In today's numbers, we also have 3 individuals associated with the Summit Care Balcombe Hills aged care facility. As you recall, we did have some healthcare workers at that facility that tested positive and were infectious at that facility. That facility is in lockdown, and there's been a program of testing, repeated testing of all the staff and the patients. Late last night, that came back to indicate that 3 of the people at that facility, residents of that facility, a woman in her 80s, a man in his 80s, and a man in his 90s. Now, pleasingly, those 3 individuals were fully vaccinated. But out of the abundance of caution, they've been offered transfer to Westmead Hospital for observation, and to date, no further residents have tested positive. But there will be continual cycles of testing in both our healthcare settings and this aged care facilities, and that will need to occur for 14 days since their last exposure to the infectious person before we really understand the full impact in those settings. In terms of areas that we really want to encourage high rates of testing, around Fairfield, Marrickville Metro, Auburn, and just anyone with any mild symptoms. There are a number of workplaces that are open because they are essential, and we particularly want to tell you that your workplace manager would much prefer you call in sick if you have the most mildest of symptoms than go to that workplace and potentially shut that workplace down because you've attended. So please, even with the most minimal of symptoms, don't go into the workplace. Instead, isolate immediately, get tested. In terms of venues of concerns, we've also had an alert in relation to the Commonwealth Bank at Roselands Shopping Centre, 24 Roselands Drive in Roselands. Anyone who attended the Commonwealth Bank at the following times is a close contact and must immediately get tested and isolate for 14 days, regardless of the result, and call the 1800 943 553 unless they have already been contacted by New South Wales Health. There were a number of text messages that were sent out overnight, but if you haven't been alerted by New South Wales Health, please let us know that you were there. So Monday, June 28, between 8 a.m. and 5 p.m. Tuesday, the June 29, between 8 a.m. and 5 p.m. and Wednesday, June 30th, between 8 a.m. and 3:30. We'd also like to do a particular call out to young adults in the community. We know that this is the trying time for young adults who want to socialise with others. Please continue to get tested, and also be assured that anything that information that is given to public health will not be shared. It is important that when people are speaking to contact tracers that they feel reassured about the fact that we will hold information in a confidential way, and that goes for all people, not only young adults, but particularly messaging to young adults here. So it is important that you're honest with the contact tracers. Also, when our contact tracers are going back and looping around and confirming that when you become a case and you've been a close contact, we ask you about, double check that you haven't had any breaches or any missteps. Again, we'll be sad if you have, but please be open and honest with us. The consequences of not letting us know about a lapse are incredible at this sort of critical phase in our response. And so please, we know everyone makes mistakes, but don't redouble that mistake by not being very honest with us in our history taking. And also, I'm calling upon young people who are incredibly connected through their social networks, social media. Please help us to get those messages out. Please reinforce the messages, and please be sort of role leaders. We know that you are so committed to keeping each other safe and also those loved ones around you. So particular call out to young people. Thank you.
Thank you, Dr. Chant. Premier, Minister, good morning. 86 infringement notices issued this last 24 hours. We've spoken today about the movement order, people in Greater Sydney moving out of Greater Sydney against the order. 2 instances of that just recently. 2 people travelled to Dunedoo, which is a small town in Central West. Police were alerted to that. They drove along, they found the car. Police have technology to make instantaneous results in terms of looking at the registration of that vehicle. It happened to be unregistered, it was parked incorrectly. Those 2 people were easily found. The community identified them. Police caught up with them quickly, issued infringement notices, and then directed back to Greater Sydney. The second example is 3 people who decided that they'd go on a camping trip out of Greater Sydney to the Oberon area. The first point of contact in the Oberon area, they were recognised as non-local people. Police were notified. Police attended to the Oberon area, found those 3 people, issued public personal infringement notices for $1,000 each and returned to the Greater Sydney area. Just 2 examples in the last 24 hours, again, of people who are moving outside of Greater Sydney, absolutely against the public health order and putting themselves and other people at risk in terms of the virus. The other example that I'd have is that we spoke yesterday about southwest Sydney, about Auburn and Bankstown being particular areas of concern in and around central business areas and shopping areas. Yesterday we deployed 200 additional police into that area and found many people not complying with the public health order, which is really disappointing when the warnings have gone out there in and around shopping areas, close contact areas, areas which we are vulnerable, and people continue to refuse to put on a mask. The message is that if you go outside the public health orders, if you continue to do that, whilst ever those public health orders are in place, police will take action. The other important point today, I think, is around those businesses that want to make a statement around their views or their opinions. The health orders are the health orders. They are law. Fundamental obligation on police to investigate, to respond to complaints. We will continue to do that. This morning, Dr. Kerry Chant and the Minister have provided me with assurance that where we need to, we will get show cause notices issued, as we did at Jindabyne. The next step will be closure orders under the Public Health Act, and we'll take that action. Thank you.
I just want to stress that in the majority of the COVID pandemic, the most dangerous places to get the virus have been in hotels, clubs, pubs, restaurants, hospitality places where people forget that they should be a little distant. But right now, the most dangerous place is actually our homes. Aussies tend to think of their home as their castle, but right now it can be COVID central. There is only one reason why you should be leaving your home at the present time, and that is caring for somebody who needs that care. Now, obviously that can be a range of issues. It could be you have frail or elderly family, relatives, friends. It could be that you're visiting someone with a disability, someone who has a mental health issue, and that's understandable and that's entirely appropriate. But if you do have the need to go to someone's home, it would be very wise for you to avoid kissing, cuddling, closeness, any proximity at all can mean that this virus can get you and spread it then to others when you leave that house. I want to stress that being outside is the safest place. If you have family or friends or relatives who need to be cared for, then perhaps you should think about, particularly with this magnificent weather, going outside. If the person can't leave their home, then perhaps outside in the yard, outside on the balcony is still safer. We know fresh air environments are certainly the safest place to be during this pandemic. If you can take them for a walk, go to the park, go for a walk, do something. But just remember, right now, our castle, as I said, can be COVID central. Thank you.
Premier, you talked about intentionally breaking the government's coronavirus rules and stressed people need to not break those rules. Was that a specific reference to the Bar or Cafe, or are there other instances of people doing the wrong thing? No. And Dr. Chant was talking about close contacts, not telling contact traces. Are people lying or omitting things to contact traces?
I mean, generally speaking, the vast majority of citizens are doing the right thing, but health protects everybody's privacy, but there have been instances where people have continued to visit others in their homes when they shouldn't have been, and potentially have been other breaches. But we just want people to know that we would much rather you tell us the truth without consequence, so that we can actually find all those potential cases. And I'll just say that in general terms. I mean, look, overnight the figures are where we want them to be. Obviously, the closer we get down to that level of zero community transmission, the better. But they're still likely to bounce around because, unfortunately, it only takes one or two people not to do the right thing for things then to go up. But I just appeal to everybody. If you are a close contact, you should not leave the house. Even if you need medical attention, you should ring somebody and the attention will come to you. If you are a close contact, it doesn't mean you can still visit relatives. It doesn't mean you can act normally. And we just ask everybody to please follow the rules. The rules are there for a reason. We know in a perfect world, if 100% of people did everything we asked them to do, that we would have a situation where we could see us coming out of the lockdown in a timely way. And we want to see that happen. So the next few days are absolutely critical. And as you know, the cases that are popping up today very well may have occurred as we went into lockdown. There's always a lag between people's activity and the cases we see. So we don't want that lag to then give us concern when it comes to the time of determining what happens moving forward. So I just appeal to everybody, please tell us the truth. Your privacy will be respected. But at the same time, please know that if you do the wrong thing and you know you're doing the wrong thing, you're risking all of us in having to stay in lockdown longer than we want to or need to.
Premier, you say the next few days Premier, you say the next few days are critical. We have been hearing that for the last couple of days. So when will you be making a decision on whether this lockdown's extended or not?
Well, obviously that decision rests on the health advice, and myself and my colleagues will consider the health advice. But what health experts look at is what Dr. Chant has already commented on. We look at the trends, we look at how many people have been exposed in the community, and that number pleasingly overnight was a very 2 or 3, which was very pleasing. It means that 13 out of the 16 cases were in complete isolation for the whole duration. 1 was for part of the duration, and then 2 were exposed in the community. So those numbers relative to what we've been seeing are very pleasing. But we need to make sure that can be sustained over the next few days, and also sustained when we lift the lockdown. So that's the key issue, to make sure.
Will you be giving residents?
Look, we would like to give the public as much notice as possible. We would like to give the public as much notice as possible, and that's obviously why we will take the health advice in due course. But I also appreciate the public is used to taking advice from us in a timely way. For example, we gave a few hours notice for the lockdown, and I deeply appreciate that most people respected that as soon as it was 6 o'clock this time last week or the day before. We will try and give the community as much notice as possible, but I also appreciate the community would want us to make sure that we're considering all the facts, that we have all the evidence before us, so that we can get out of the lockdown in a timely way.
Premier, there seem to be clothing.
Like, we're encouraging people to walk, but a lot of bars were offering like BYO drinks and that, and down in Bondi there were shots of lots of people without masks on. Are you concerned about that?
Oh yeah, look, absolutely. If you're outdoors exercising, you don't need to wear a mask. But if you're in social contact, if you can't maintain your social distancing, absolutely. And Deputy Commissioner Warboys actually expressed his concern about that matter. Do you want to comment further on that? Yeah.
Thank you. Is it legal to street drink?
Depends whether the local government rules allow that, but there's a couple of really important points. And They are that responsible service of alcohol applies to every premise, no matter what sort of licence that you have. There certainly is requirements around supplying alcohol in containers that are open, then moving out onto the street where there might be some local government alcohol-free zone restrictions around that. But if you push that to one side, most importantly, this is an activity that sees people coming together in close proximity. I suspect these people aren't doing this alone, that there would be a group of people moving around. We've made the police area commander along the beaches and in Bondi very much aware of it, and we'll be looking at that today and ongoing.
Do you think NATCAB missed a chance to set a target for a mass vaccination target, and do you think that the four-phase plan is ambitious enough?
Oh, look, I think citizens of our state and our nation would like timelines, and I've made that position clear. I welcome the four-phase program. It's in line with what New South Wales has been saying for a long time. But I also think the public would like to see some timeframes, and I look forward to being part of those discussions.
You're going to model, and the Doherty Institute's going to model this vaccination threshold, right, coming into phase 2 and beyond. In your mind, is that vaccination threshold the 80% that you've posited previously, or would you be open to considering other thresholds?
Oh, look, I'm happy to support the expert advice, but remember, I've been saying 80% of the adult population. The figures that have been used are of the entire population. I've been very specific to say when New South Wales hits that 10 million jab, we can start considering other matters. But if National Cabinet has determined a unified approach across the nation, I'm more than happy to support what that unified approach is, but I think we need to be ambitious, and we also need timelines to give to the community.
Premier, there seems to be an irony here that the Delta variant is a lot more virulent, yet the freedoms exercised by people in Sydney right now seem to be greater than the lockdown last year. We're seeing florists open, clothing stores open. What possible justification is there, and why are we requesting these people do the right thing rather than enforcing it? It's just they stick out so obviously on a street, a florist, car wash.
Well, we think very strongly that the rules we've put in place are vastly being respected. There'll always be exceptions, but also we appreciate that when you're asking the population to stay at home except for essential services or essential matters, that you need to provide those opportunities. And I want to provide confidence to our citizens that we only burden them to the extent we need to, but we ask everybody not to leave home unless you absolutely have to. As Dr. Chant has said repeatedly, outdoor exercise is a good thing. It's a good way to determine, leaving the home. It's a safe setting. What we worry about are indoor settings, indoor shopping centres, or indoor homes where people think it's okay to visit one another. Well, it's not. Most of us are making sure that we don't visit relatives or make sure that when we are wanting to interact with others, that it's a safe outdoor setting. And that's really the case. And I just appeal to everybody to do the right thing. But I think our citizens also know that by doing the right thing, we can achieve what we need to together. But if too many people don't do the right thing, well, then that's cause for concern.
There were businesses getting $5,000 fines quite regularly last time. Have there been $5,000 fines for businesses just for being open?
Can I make it very clear that New South Wales, unlike other states, has never determined what is essential and what is not essential because when it comes to businesses. For example, whether it's logistics and freight who need to move around goods and services, whether they're essential items people need to go and get. We have exactly the same rules that we had in last time. So any suggestion that these rules are different to last time isn't correct. The same rules apply. But what we're asking people to do is make sure they adhere to the rules to make sure that we can get out of the lockdown in a timely way.
Summit Care, how concerned are you by potentially the spread of the virus in this centre and also the health of the residents who tested positive given they are vaccinated?
That's a question for Dr. Chant.
Obviously, we're very concerned about any COVID in elderly patients. We know that as you get older and have additional underlying health conditions, that getting COVID is a very, very significant issue for you. So, of course, we're very concerned. What I'm pleased to say is that the local health district's working very much with Summit Healthcare there, and the Commonwealth Government has been coordinating a comprehensive response to that facility. It's pleasing to see that the vast majority of residents, I think from memory it was around 136 or 137 out of the residents were vaccinated out of about 145. Now, those numbers are a little bit rubbery because my recall's not perfect, but that's sort of the sense that that was a very positive outcome. We also know that some of the aged care workers were vaccinated, and we'd like to see that increase because we want to see aged care protected. But in terms of this, obviously it's a watch and wait. We're doing everything we can to ensure that infection control procedures are in place. That area has been, of impacted areas, been locked down, even within the lockdown of the whole facility. And certainly we need to wait and see how those individuals progress. At the moment, I'm not advised that they have any health consequences of COVID at the moment, but obviously that may change.
So it seems like some of the staff are unvaccinated. Do you have any indication how many are unvaccinated, and have they also been working across multiple aged care facilities?
Look, I think that's probably best directed to the Commonwealth, who probably has collected that data in relation to aged care, given their responsibilities in that area. But if we've certainly got any information on that, we can look at it. But the Commonwealth, I know, is requiring notification in relation to vaccine coverage.
Dr. Chan, there seems to be a couple of dozen...
Sorry, James, and then...
Yeah, there seems to be a couple of dozen cases that aren't linked to the Bondi outbreak, or the outbreak that started with that limousine driver. Do we have multiple strains, or is it just that one strain that came from the limousine driver?
Look, it's one strain, and what's interesting is, and this is why it is incredibly important people come forward for testing, is we sometimes make the links retrospectively and we understand then the pattern. The more confidence we have that we've mapped this whole chain of transmission and that there aren't these missing links that could have set up their own chains of transmission, the better, and the more accurate advice we can give to government about the extent and whether we've mopped up any unrecognised chains of transmission. So that's a moving feast. As you know, we report the cluster summaries in our weekly epidemiological report, and even from week to week, those linkages can subsequently be made. I'd just also like to say thank you to the community who, just for the cases to be re-interviewed and re-interviewed. It is a stressful time if you've been given a COVID diagnosis. Often, late into the evening, you're worried about your friends, your family, and so agreeing to those multiple re-interviews as we clarify points with you and tease those connections, but it's an ongoing process to find those linkages.
Are you confident that schools will open up next week? And how important is it to vaccinate children and young people for us to be able to open up again? We've had a lot of health experts on radio this morning talking about that as being an essential thing for us to be able to open up.
Look, as a public health practitioner, I'm a strong advocate for vaccination. Obviously, we need to, at the moment, our priority is vaccinating older people and adults, and as the vaccine supply, I think we can have these conversations about children. But I would be expecting that in 2022, we would be looking at rolling out vaccines for school children, but really it depends. Our priority still needs, at the moment, vaccine is still constrained, and as that vaccine becomes available, we still need to prioritise the elderly, aged care workers, and those with underlying health conditions before we move ahead to the younger age group. But we have seen with the Delta strain that it is more transmissible. And we ask, obviously, the more people we can get vaccinated, the better.
Dr. Chen, that we need for the final week of lockdown, or essentially a long period of time, for all of the new cases to be in isolation for their entire infectious period to, consider coming out of lockdown. Is that still your view? And
no, James, I think I would have never given a black or white. I think I would have always put some context around my comments. I think I'm very clear with the community that it's not necessarily the pure numbers. and in essence, the pure numbers can belie the true facts beneath it. So the sort of things we're interested in is whether people have been in isolation for the full infectious period and therefore posing no risk of onward transmission, whether we are getting those unlinked cases and whether we are concerned about the settings those unlinked cases are occurring in, and whether there's any other contextual factors, that testing rates are low, whether there's any intelligence coming from our sewerage surveillance which indicates cases in areas where we haven't recognised cases. So there's usually, several factors that we look at every day to give us a sense of where we are, and that's the type of more holistic information we give to government in making these decisions.
Dr. Chan, school returning, it's an important issue for parents. You were sort of a bit equivocal there. Do you expect school will return next week?
I think, look, as I said, my role is to provide advice to the government on the settings. We've still got a week to go. What I'm actually really wanting the community to focus on at the moment is clearly the importance of getting tested, following the health advice, and we need to watch what happens over the next few days for me to, with confidence, give the best advice to government. That's all I'd like to say.
How's it tracking, though? I know there's still 7 days and you haven't got a crystal ball, but in terms of the way the graph is going right now, do you have any expectations that we will not hold you to, but as it stands now?
Yeah. Look, a lesson in COVID is 1 day does not make a trend. What we need to look at is all of those complex factors in formulating an advice, and let you know that the team here is pulling together that information and analysing it so we can provide the best advice to government. But what the community and businesses can do is really adhere to the spirit and principle of the public health order and follow all of the advice we've given. Thank you.
Thank you. Thank you.